pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really, really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
I did not imagine that the prayers of my country would have been answered so swiftly.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18. Take the vaccine to protect your family. Take the vaccine to safeguard the elderly. Take the vaccine to bring back with festivals. Take the vaccine. Take the vaccine. Take it. Take the vaccine. Need it. Take the vaccine. Take it. Take the vaccine. Need it.
This is a message from Tasha P. and the Health Promotion Unit of the Ministry of Health, Dominica.
Hey, Bernard, I see people sanitizing their hands before they enter your bus. Tell the people of Dominica, why have you enforced this?
My bus is my livelihood, and that's why I make sure all my passengers wear the mask and sanitize their hands to stop the spread of COVID-19. We all are in this together.
You have heard it here first. Let's all join the fight against COVID-19 in Dominica.
Good night, everyone, and welcome to our Ministry of Health, Wellness and New Health Investment press briefing. Tonight, it is going to take a different twist. Tonight, I will be speaking to you about a few things. One, the change in protocols for isolation and quarantine of positive antigen clients. I will discuss with you about home isolation and quarantine. I will speak to you of the responsibility of you, the public, in helping us help you in ensuring that persons who are on quarantine or isolation in their home maintain that, amongst other things. So first, let us just look at the new protocols in terms of isolation and quarantine protocols. So the first thing is that asymptomatic COVID-19 cases who are vaccinated. And when I say asymptomatic, I mean persons who have no signs and symptoms. So no cough, no headache, no dizziness, no diarrhea, no loss of taste or smell. These are persons who are asymptomatic. So these persons who have fully vaccinated and have tested positive by antigen or PCR of COVID-19 will be isolated at home. However, the first thing that needs to be established is that you are truly fully vaccinated. And when I say fully vaccinated based on the protocols, it means that you have received your full 2 doses or 1 dose in the vaccines that are only 1 dose, at least 2 weeks before the time that you come to do your testing. So let me just say that again. To be considered fully vaccinated, you should have received 2 doses in a 2-dose regimen and 1 dose in the 1-dose regimen at least 2 weeks prior to your date of testing. The other requirement is that there are a number of vaccines that the Ministry of Health, Wellness and New Health Investment and also WHO have approved. They are AstraZeneca, Oxford AstraZeneca, Sinopharm, Pfizer, Moderna, and Johnson & Johnson. So if you are fully vaccinated with these vaccines, this is the category of persons I'm speaking about. You would also require to bring in your vaccination card because that is the only way we can verify that you are fully vaccinated. So if you are asymptomatic, meaning without any signs and symptoms, and you test positive for an antigen or PCR test, you will be quarantined at home. A red wristband will be placed on your arm, and that is to be able to identify you that you are a COVID patient and should be isolated, COVID positive patient. Now, there is also another category in terms of how patient will be sent home for quarantine. And this is in the case of the unvaccinated patient. If you are unvaccinated and you are asymptomatic, test positive by antigen or PCR of COVID-19, first you will be taken to the COVID isolation unit. On the 5th day, your PCR or antigen test will be redone. If you are negative and you also do not appear with any signs and symptoms, the red wristband will be placed on your arm and you will be sent home for the remainder 5 days of quarantine. Okay? So we have 2 categories of persons who will be on home quarantine. First, those who are asymptomatic without signs and symptoms and fully vaccinated will receive an immediate red band, allowed to go home on home quarantine, and we will speak a bit later of what will apply. Also, persons who are asymptomatic, unvaccinated, will go to the government isolation unit. On the 5th day, they will be tested again, and if they are negative and also they do not have any signs and symptoms, they will be allowed to go home for a remainder of 5 days home isolation. Okay, so what do you do when you are isolated at home? So first, I just want to speak in terms of what is required. What do you need while you are at home quarantine or isolation? Remember, earlier on last year, we spoke about the need for each family to have their COVID family plan because we identified that COVID-19 is a health disaster. And in preparation of your disaster box, one of the things that we advise is that you also have a COVID kit. And in that, you would have things like your gloves and mask and alcohol and sanitizing equipment. So that means you would have already had some of the critical supply you need to be quarantined at home. We also advise that persons identify which room or which location will be used to quarantine persons who may have flu-like symptoms. So this is when your plan, your family plan, is going to be activated. So what do you need? You need mask, because the person who is isolated at home has to wear mask at all times. You need hand sanitizers for cleaning and sanitizing, and of course they have to be more than 70% and above. And of course, nothing is better than the original soap and water. The other thing that you will need is a thermometer. Now, this thermometer is to take your temperature. And what you are to do, you are to take your temperature daily, record it, and report to the healthcare professional by telephone. Okay? So your district team that you live in will be expecting you on a daily basis to call in your temperature reading. Now, when you are discharged from the quarantine, you will be given the information as to the district team, the number that you call. Okay, so on a daily basis, it will not be the district team calling you to get your temperature. Okay, because remember, our health is our responsibility. So you're going to take your temperature, record it, and then call the health team to give them your reading daily. Now, there are a number of things that you should do and then you should not do. So you should take your temperature daily, record it, and give and call the healthcare team. You must not leave your home. You must not allow persons to visit. You must not remove the wristband placed by the healthcare professionals or providers. It is an offense by law to remove. That means if you remove the wristband and it is not removed by the healthcare professional, it is a breach of your quarantine agreement. Okay? So it also means that when the healthcare providers come on the 11th day, because remember, the home quarantine is for a total of 10 days. If they come on the 11th day to remove your bands, your wristband, and it is not there, that will indicate that you have breached the quarantine protocols. And also, you must wear your mask while at home fully, and you must isolate yourself from the other persons living in the house. We also wish to inform that while you're in quarantine, the different or isolated in your rooms, your utensils, the spoons, the forks, the glass you drink with, should only be used by you. However, to clean them, it's simple washing with soap and water. So your different utensils, your cup, your spoons, your bath towels, different things that are personal, should be used only by you in the room that you are in. Of course, to boost and to ensure that you get back to the level of wellness and to ensure that there's no further symptoms that will appear, you would want to ensure that you eat a balanced diet. Now, the balanced diet is incorporation of foods from all of the food groups. So your protein is important, your carbohydrates are important, your fats and oils are important, and of course your vegetables and minerals, because you want you to have more of an alkaline as opposed to acidic diet. Okay, when we talk about acidic, we talk about the high sugars and fats and oil and salt and processed foods. So we want you to eat more of a plant-based diet. So your fruits and vegetables and lettuce and all of the green leafies that we really love. Okay, so this is what we want you to do when you're quarantined at home. Now I want to say something to you. And I want to say something to, in fact, all of us, even those who are in the studio here with me. This is the time when we, the public, have to show how much we appreciate our health, how much we appreciate the work that the healthcare workers have been doing. I know you have been waiting to help us. I know you have felt powerless as to what can I do to help my healthcare providers. Now, this is your time. What is your responsibility is to ensure that persons who return home to be in isolation remain inside and be isolated. So you know what we would like you to do? Anybody you see with a red wristband on their arm outside, that you need to call us immediately. And the numbers you can call directly to the police, which is 266-5161. I will repeat, 266-5161. So if you identify anyone, it could be your neighbor, your friend, your cousin, on a bus or anywhere with a red wristband, then you need to call 266-5161. You can also call all of the hotline numbers: 448-2151, 448-2171, 448-2156, 448-2153, 1-800-219, 611-4325, 266-3207, and 266-4884. So if you identify anyone, and we have to remember that when and if these people break the protocol and come outside of their home, you, your family, your friends, your loved one are at great risk. Okay? So this is one of the ways you can help us in helping you. The other thing is that we have to ensure that while these people are quarantined or isolated out in their homes, that they may need supplies and you can assist. So it takes the whole neighborhood or the family to assist. What you do is that through either social media, through WhatsApp, the person can communicate to you what they require. They can even place the money on their porch or outside. They return inside, and then you can come collect it, go get the supplies, and take it back to them. Okay? And this will be doing a very excellent job. I cannot imagine how better help that would be for us, the healthcare professionals. So again, I want to repeat that anyone seen outside with a red wristband, you call the police number directly, 266-5161, or any of the COVID health hotline numbers. Now I want to speak to the persons that we consider primary contacts. I know you remember that before all primary contacts would have been taken up to the government quarantine. Now this cannot be so anymore. And I know you understand why. The system is overwhelmed. So what is required for the primary contact is from the time you identify whether the positive patient calls you, whether you receive a call from primary healthcare or other, you should quarantine off yourself, right? So first, primary contacts. The next thing you do, we advise that if you have signs and symptoms, you call the hotline. If you do not have signs and symptoms, you quarantine yourself, and at least by the 5th day, you do your antigen test. Now, if your antigen test is positive, then the protocols I just mentioned in terms of asymptomatic and positive and unvaccinated will apply to you. Okay, so the protocol. So if you are positive and without symptoms and unvaccinated, you will go up to the quarantine. On the 5th day, you'll be tested again. If you are negative and without symptoms, you'll return home and will be on 5-day home isolation. However, if you have tested negative it doesn't mean that you're free to roam. I want to repeat that again. As a primary contact, we would appreciate that you isolate yourself immediately. By the 5th day, we would like you to come to have an antigen test. However, if you're having signs and symptoms, we would not want you to leave home and we would like you to call the hotline. If when you do that antigen test on the 5th day, it is negative, it does not mean that you are cleared now. We would want you to remain home, quarantine for another 5 days. During that period, if you experience any signs and symptoms, we would want you to call the hotline. Okay? Then we have another category of persons who, for some reason, when they come into town or they board the bus and they're approaching the check side or they go to the banks, they wear their masks. But when they return to their communities, they do not wear masks at all. It's not a Rosa thing, it is a everybody thing. You have to wear your mask all the time. And we do not want you to wear the mask because the Ministry of Health or the government or the police is telling you wear the mask. We want you to wear the mask because you remember, you are cognizant, you know that this COVID-19 virus is spread by respiratory droplets. And when we speak and we sing and we talk and we cough and we sneeze, there's a risk that infected droplets can be expelled into the air, drop on surfaces that we touch, stay in the atmosphere for some bit in some circumstances, and also go on to other persons that we are in close proximity with. Okay? So that is why we want you to wear your mask, because we know it is still transmitted by respiratory droplets. I also want to speak to some of our younger persons who believe that this is just a journey and get COVID, get better, summertime, hot girl summer. We really do not know what may be some of the long-term effects of this COVID-19 infection. And many times in health, we know that there are conditions that we may get that are irreversible. So it doesn't matter what specialist, what doctor you may go to, the damage is already done. No COVID is better than mild COVID or severe COVID or death. Okay? So we want you to remember that. We also want you to remember all of the prevention protocols for COVID-19. We want you to wear your mask and wear your mask properly. Ensure that it covers your nose and your mouth. It should not be worn on your forehead, nor under your chin or hanging to the side of your face. We want you to wash your hands properly with soap and water, ensuring that every area of your hand is washed properly. Be mindful to remember within the crevices of your fingernails, and you know these areas, that's where the quasts like to collect. We want you to exercise proper respiratory etiquette. So if you have to cough or sneeze, we prefer that you cough into a tissue, use it only one time, and then discard and wash your hand. You know, sometimes a sneeze may just come. So you do not have time to get a tissue. Instead of doing it directly into your hand, we want you to do it with a flex elbow. We want you also to continuously clean, frequently use surfaces. And today, while I was having a discussion with some persons, they did indicate to me, nurse, in the case where we are at the home and we only have one bathroom, how can this be done with a person in isolation? Of course, the person should have full bathroom privileges, but sanitization and cleaning of these frequently used spots is very important. What do we promote and know that it has scientifically proven to destroy? The good old bleach. You know, in Dominica, we love it. We know it is cheap. What is different is the ratio from bleach to water that we use. And it is 1 part of bleach to 9 parts of water. So that means if you use a cup of bleach, you have to use 9 cups of water. If you use an ounce of bleach, you have to use 9 ounces of bleach. So we have spoken in terms of wearing your mask and wearing it properly, respiratory etiquette, washing your hands, cleaning of surfaces. The other thing is social distancing or physical distancing and preventing being in crowds. And that is where I say to you, stay home. If you have nothing to do in town, in the shops or outside, please stay home. Please stay home for us. Please stay home to reduce the spread. Please stay home so we can flatten this curve. So we want you to, if you do have to go out, identify who is the strongest person at home, and generally the person who is more willing or able to comply with all of the protocols. Okay, so we want this person. Don't go for sugar today and milk tomorrow and cream of wheat the day after. Try your best as much as possible to go and get your one set of things. You identify if it's twice that you're going to leave your home, and do that. The other thing is that we would like you to limit your alcohol intake, right? Limit your alcohol intake. And we would also like you to eat properly. We want you to boost your immunity. Okay? We want you to eat healthy foods. We want you to eat foods high in probiotics, which is responsible for gut health. It means that if you eat foods that contain viruses and so, it goes down to your stomach and the probiotics help it fight it. We want you to eat your fruits and vegetables, and we want you to eat your water. And yes, we also want you to take the vaccine. Vaccines have known to work. It is the simple and one of the safest way to eliminate diseases. Polio, tetanus, measles, mumps, rubella, diphtheria, all of these have been used before. And some of us are alive today because of this very vaccine. So to conclude all of the prevention protocols, we would really appreciate that you get vaccinated. I just want to indicate to you what are the testing sites for tomorrow, where I can get tested. So you can go to La Plaine at 10 a.m. It begins at 10 a.m. You can go to Delices at 2 p.m., Cassibruce, 10 a.m., Saint-Sauveur, and these are the different health centers, 10 a.m., at the Pierre Charles Secondary School in Granby, 10 a.m., at the Granby Health Center from 2 p.m., of course, the Windsor Park Stadium from 9 to 3. There will also be reswabbing of persons with 5-day contacts and swabbing of contact tracing team. And we will have testing in Marigot Health Center at 10 a.m. Of course, we also continue at Layu Resource Center and Dubla Health Center from 10 o'clock. We will also be in Kenfield at Allmill at 11 o'clock, Tarish Pit at 3 p.m. from 3 p.m. and also the Grotto Home for the Aged at 11 o'clock for residents and staff. Let me just repeat that again. So tomorrow, Tuesday, August 17th, we will be at La Plaine at 10 a.m., Delices at 2 p.m., Cassibruce at 10 a.m., the Cassibruce Health Center, Saint-Sauveur at 10 a.m., Pierre Charles Secondary School from 10 a.m., Granby Health Center from 2 p.m., Windsor Park Sports Stadium from 9 to 3 p.m. We will also be doing reswabbing of 5th-day contacts and swabbing of the contact tracing team. Marigot testing team at 10 a.m. We will be doing Layu Resource Center, Dubla Health Center from 10 a.m., Allmill at 11 a.m., Tarish Pit at 3 p.m. and Grotto Home for the Aged at 11 a.m. for residents and staff. I would also like to inform that the curfew, which ends tomorrow, will be extended, and the Honorable Prime Minister will give an update on this extension when he addresses the nation tomorrow at 12 noon. Okay, so the curfew, which ends tomorrow, will be extended, and the Honorable Prime Minister will give an update on this extension when he addresses the nation at 12 noon tomorrow. My people, I just want to wish you a blessed night. I just want to say thank you to all of you who have been consistently adhering to the protocols. All of you who have taken your vaccines. All of you who have helped in this campaign, I want to say thank you. There are some of you who have assisted in the campaign but have not done so consistently. Let's do it more. To those who have not done it at all, there's no time better than to start. Remember, we are all in this together. In wrapping up, I just want to say that, of course, I want to thank all of our healthcare workers, our nurses, our doctors, our lab techs, our cleaners, our drivers, our orderlies. I just want to say, keep pressing on. We got this. The anchor holds. Though the ship is battered, the anchor holds. Though the sails are torn, it will get better. Dominica, I thank you. I just want to also indicate that in terms of our new cases of COVID, we now have a total of 575. I think that may be incorrect, Chad. Okay, so I just want to thank you for listening, and I just want you to go out there and please comply or adhere with the protocols. We are all in this together. Have a blessed night, Dominica.